Joining me this afternoon is a 70-year-old COVID survivor who spent nearly 3 months in hospitals after contracting the virus in April of 2021. She's here today to tell her story on how COVID has changed her everyday life. Shirley Madden, thanks so much for being here.
Thank you for having me.
So, to start, let's go back to April of this year. When did you learn that you had COVID, and when did it become obvious that you were experiencing complications?
Well, I went to the hospital on the 16th of April and in Lloydminster, and they immediately transported me to St. Paul's Hospital in Saskatoon by Stars Ambulance.
Mom, but you were sick
Yeah, and but I was feeling a bit sick before,
like 11 days.
I guess for about 11 days before that, and the kids kept wanting me to go to see the doctor, and of course, being a bullheaded Irishman, I just didn't go. And um, eventually, like I said, then on the 16th, I did go, and I was diagnosed with COVID and pneumonia. So, and then when I got to Saskatoon, I was in an induced coma for, I think, a little over 2 months.
And on multiple occasions, members of your family were reached out to by hospital staff with the worry that you might not make it through the night. So, what was that like for you as well as your family to feel like you were saying your final goodbyes?
From what the kids have told me, it was a very trying time, and to be notified 3 times, I think that to get in there that I wasn't going to make it, and then the next day I would turn completely around and be okay. And so it was a very stressful time for the family.
And since contracting the virus, you've developed a number of health conditions, including type 2 diabetes. Could you just maybe speak to how that's impacted or changed your everyday life?
Um, well, it certainly affected my health, of course, and along with diabetes and COPD, I also have AFib heart problems, and um, I never smoked in my life, so I don't know where the COPD comes from, but it's there. So it's slowed me down an awful lot. And yeah, I just going from 6 pills a day up to about 20 some a day. So, and then I have to do breathing exercises to strengthen my lungs and a lot of things. I can't go for very long walks, and my oxygen levels drop. But other than that, life is good. I'm still here. So
And prior to your hospitalization, you hadn't been vaccinated. And I know it was something that you had intended to do, but it just kept getting put off. But for people who are maybe in that situation now, or maybe they're against vaccines in general, what would your message be for them?
well, I think my message would be to don't be bullheaded and think of others, think of your family, your children, whatever. Because I almost lost my life, and just my faith, I guess, is what kept me going, and having my kids there when they could be there was an eye opener for me as far as getting the vaccine. And I've had two of them now since I got COVID. I've had two vaccines. Um, I'm waiting for the third one. And by the looks of it, COVID is not going away anytime soon. So I just urge people to really think hard about, getting the vaccine and not listening to Google or to their friends or whatever. That, talk to your doctor about it. And they're the ones that deal with it every day. And I'm just thankful that I'm still here.
Thanks so much for your time today, Shirley.
Oh, you're very welcome. I hope everybody out there gets a message from this.